It is so exciting to have all of you here on the line with us tonight. Exciting that you're considering family medicine for your career, and exciting that you're considering McMaster University as the training program to help prepare you for the launch into independent practice in family medicine. Our town hall webinar tonight is going to help you learn a bit more about 3 of the sites offered by our family medicine program at McMaster University. First, we'll hear from Halton's site, followed by Hamilton's site, and finishing up with our Niagara site. So Halton, Hamilton, and Niagara are the 3 McMaster family medicine programs that you'll have an opportunity to hear a little bit about tonight through a presentation by the site director for each of those sites. And you'll be pleased to know, I'm sure, that we do have a resident representative here from each of our 3 sites for the question and answer period. The question and answer will be held immediately following each individual site presentation so that you can target your questions to the particular site and its resident and site director, you know, in a timely manner right after that presentation. We have Christine Merritt with us on the line tonight as our Central Program Senior Education Associate, and many thanks to Christine for making this webinar possible tonight. I also do want to thank our education lead, Nancy Devlin, who has joined us on the line tonight as well and is coordinating CARMS behind the scenes. We owe tonight's activities to all of their hard work. And with no further ado, I'll pass things over to Dr. Sue Borden, our site director for Halton.
Hi there, everyone. Thanks so much, Heather, for the introduction. As Heather mentioned, I'm Dr. Sue Borden, and I am the site director for the Halton McMaster Family Residency Program. I'm a McMaster Medicine graduate. I am also a McMaster Halton Residency graduate. I was part of the first cohort that went through Halton. I set up my practice here in Burlington at the Halton McMaster Family Health Center. I had my baby at Milton District Hospital. And now I'm site director, so you can see that I'm really enthusiastic about Halton, and I'm not even from here. So the big thing about residency and CARMS process is don't panic. There are so many important things to go through, but take your time. When it comes down to it, there's going to be so many decisions, so many places to choose from, so many pros and cons. Where does my family life fit in? What do I like to do for outdoor stuff, work-life balance, my friends? The important thing to remember is that when you come out from McMaster Residency Program, you'll all be super doctors. So with so many great options at McMaster, why should you choose Halton? So here we are in Halton. You can see us highlighted there, which includes the communities of Burlington, Oakville, Milton, and Halton Hills. We're nicely nestled in between Hamilton and Toronto, so wide open spaces, but if you really want to take in a Raptors game or a Ticats game, you can still get there once COVID is all over with, of course. The key to success in Halton is really understanding and appreciating you, the resident, and how you learn best. That's the big key for us. So first, I'd like to show you some of our teaching spaces. So this building right here is the Halton McMaster Family Health Center. This is the largest of our sites and where the majority of our residents are housed. Throughout Burlington, Oakville, and Milton, we do also have solo community practices where we do have our residents stationed. So this is a view from inside our education suite, which is located in the same building. You see these nice little spaces and a nice rooftop patio for access to have some quiet time overlooking Lake Ontario. So here again are more looks at the interior of our clinic spaces. Here's one of our local retirement homes where folks in our area, I have a giant 100-pound dog stomping underneath me, my apologies, that some of our staff work at. In Halton, our hospital-based rotations are split between Halton Healthcare and Joseph Brand Hospital. So Halton Healthcare is a multi-site hospital program, which includes Milton, Oakville, and Georgetown, and Joseph Brand is a standalone facility. We're incredibly fortunate in Halton to have a big variety of brand spanking new facilities for our learners to work in. So here we have Milton District Hospital, which is brand new as of a few years ago. I could even say when I went there to have my baby a few years ago, 10 years ago, that it was a much smaller hospital, and now it's very bright and gleaming and much larger. We've just actually introduced emergency medicine as a rotation here, and for many years a lot of our residents have enjoyed hospitalist medicine here. This is Oakville, which is the largest of the facilities that is part of our program. Again, a big, bright, stunning new space where we do have a lot of resident rotations, emergency medicine, hospitalist medicine, care of the elderly, and untold numbers of elective spent there. I will put a plug in for Little Georgetown Hospital. It is quite far away from us, but it is a place that we certainly do have learners who are quite interested in doing hospitalist medicine and a combination of ER there. It is a smaller facility, but certainly has a lot of fantastic learning opportunities. They're still waiting on their bright, shiny new exterior. And last but not least, Joseph Brand Hospital. This is attached to our teaching facility at Halton McMaster Family Health Center. And the majority of rotations will be through here. Hospitalist medicine, emergency medicine, pediatrics, and obstetrics and gynecology all will be through here, as well as, again, a number of the elective rotations. So our main hub here, which houses the Halton McMaster Family Health Center, as well as our education suite. It's conveniently, as I mentioned, attached to Joe Brandt and across the street from the Lakeshore Trail if anyone is ever interested in actually taking some time off during lunchtime instead of doing notes. Here again, more photos inside our space. So you can see it's a nice, big, bright, beautiful facility, lots of computers and lots of big, bright windows to look and enjoy the outside. And these are some pre-COVID photos of our residents who got to enjoy so much time together. It's certainly been a challenging year for everyone in terms of those wellness and one-on-one togetherness activities, but we hope that soon we'll get back together again. And some more photos of our lovely residents and just a quick little video. Oh dear, my video is not working. Well, my video was going to tell you exactly why all of my residents like working in Halton. And that video would have told you about how various residents really enjoy the opportunity to be the first learner in line. Because McMaster Family Medicine Residency Program in Halton is not a service-based program, you are often the only learner who is in the space. So you get to be front of the line access. Even if little things like there may be another physician or a surgeon who is doing something that is interesting to you. Sometimes you can just pop on out of the rotation that you're doing and go see a colonoscopy, for instance, on a patient of yours that you've been following. It's really, really great. We also have a lot of opportunity for individual planning to go forward. So say you have a really keen interest in obstetrics, like our resident Liz, who was on with us tonight. There are a lot of great opportunities to expand your knowledge in that area. So sorry, my video didn't work. We should have tried that one. Thank you so much for taking time to listen to me talk a little bit about Halton and brag about how wonderful we are. We really look forward to chatting with you more, and if there's any questions, don't hesitate to contact us. Thanks. Any questions?
Dr. Board, resident lists are available to field any of your questions about Halton site right now, so feel free to type them into the chat, and we'll go through them one by one.
And if you don't have any right now and you want to save them up to the end of the presentations, you can certainly do that too. it seems that we have shy question askers tonight. Perhaps we give it another moment and then we'll move on to Dr. Waters in Hamilton for her presentation.
So there is a question here. How does site selection work for Halton? So I'm not sure if that's reference to how residents are placed with their preceptors, if matched to Halton. If you maybe want to speak to that, how that works.
Sorry, you've cut in a little bit and out a little bit there, Christine.
Oh, sorry.
Oh, there I see. Patients are spread out among several sites. That's okay. Typically speaking, what I do at the beginning of our match process is we have an internal match, and I send out information to all of our learners or upcoming learners to ask them if they have preferences on where they choose to live, whether that's sort of Burlington, Oakville, or Milton. I'd say the majority are split as to where they live. A lot tend to live in the North Burlington, North Oakville area. And that way it's pretty accessible to both of the major sites, being Joseph Brant and Oakville Hospital. But then with our residents who do choose to go to Milton, we try and make it so most of their rotations are up there to help make it a little smoother for transportation. With respect to couples matching rates, we've only had one couple come through that I'm aware of at this point. And they're actually currently both locuming in my office, which is really, really nice.
There's a question here about the academic half-day teaching sessions and where they're held and how they're happening amidst the pandemic.
I think Dr. Borden's connection is cutting out a little bit. Are you there, Dr. Borden? Okay.
Any other questions for my site specifically, or we can move on to Dr. Waters? I know we're probably all having a little bit of connectivity difficulties this evening with WebEx being stubborn.
I think you cut out a bit, Dr. Borden. Someone asked a question about where the academic half days are happening now. We do have a really nice space that Dr. Borden was showing in the photos, but unfortunately we are not using that right now. So we're just doing academic half day from home. We just sign in on our computers, very similar to this, and we do that as well as just small group learning on WebEx as well. I actually see one of the first questions that was asked about where residents choose to live. So I'm happy to speak a little bit about that. As you heard, there are various sites. In terms of where myself and the co-residents live, it ranges really anywhere from, I live in Waterdown, which is probably the most towards Hamilton, and then the most towards Toronto I've seen so far is Mississauga. So, and then Burlington and all there. The commute, I would say, for the most part, is less than half an hour, no matter where you live, even if you're living in Waterdown and going to Oakville or to Milton. So that's kind of around where everyone's living.
Yeah, I would say the only exception to that would be if you chose to do an elective program up at Georgetown Hospital, because it is about a 40-minute drive. And unfortunately, it is kind of a small country road to get up there as opposed to a big highway. So it does take a little bit longer, but at this point, it's just being used for elective experience. There is I'm just trying to scroll to the chat box, and I do see there's a question about teaching opportunities in Halton. We certainly don't have as many learners around, but on off-service rotations such as pediatrics and quite frequently emergency medicine, we do have clerks who are there. The obstetrics and gynecology program will be back up and running for the new academic year, and they will also have clerks, so there is certainly opportunities that are available. It's just not as many learners around, which is nice because you're not at the bottom of the pile when it comes to doing procedures. Liz, I'm wondering if you could speak to opportunities for Halton residents to connect with other residents at MAC.
Definitely. We are one of the referral sites that are closest to Hamilton, so we often you can do elective rotations and interact with a lot of the residents there. Obviously, when COVID was not a thing, we used to have central sessions, and that would be all the residents coming together from all the various sites in Hamilton and getting to interact and do learning sessions together. So there's not so much of that anymore in this current climate. But we are all connected through Facebook groups, WhatsApp groups, and so there is an opportunity to connect with residents at other sites. However, I will say that from my personal experience, for the most part, we really have our family in Halton, and our residents here are our main support system.
One of the other questions was how many learners does the Halton site accommodate? We do take 8 each year, and that of course is dependent upon the availability of preceptors, but right now we're at full capacity. So 7 of those will be Canadian medical graduates and 1 Img. And also a question about call schedules. Call schedules are variable depending upon the rotation that you're on and the facility that you're in. For most of our residents, the family medicine preceptors do have some amount of hospitalist work, so there will be call with that. It is home call, but you can certainly count on being there most evenings late. There is also for your internal medicine program that there is call associated with that. Typically it is once a week, same with pediatrics and obstetrics and gynecology. Very similar at the Oakville Hospital, though hospitalist medicine there is technically overnight call, so they provide a call room for you there. Anyone I'm missing there, Liz?
No, that's pretty much it. I will add that when you come to the peripheral sites, like Dr. Borden was saying, we do really emphasize the learning component as opposed to the service component. So for example, something like internal, where if you're doing CTU in Hamilton, you might have like a 1 in 4 call schedule overnight. That's for the most part more than we have for call at the peripheral sites. Sometimes having call only until 11 p.m. or sometimes doing overnight call, but not as frequently. And then in second year, it varies a lot just depending on what elective you choose to do. For example, for myself, I did 1 OB elective where I had a call with overnight call and stuff, but all my other rotations have been only call until 11 or home call.
There's a question here around, just around the research component or opportunities within the program. I don't know if one of the residents wants to jump in and speak to that part of the program.
Yeah, definitely. So that would be more of a central curriculum as opposed to your site curriculum. So every resident takes part in a curriculum called the Inquiry Curriculum, where we do a quality improvement project over the 2 years of residency. So that's a requirement, and it can sort of be as small or big as you'd like to take it. We also do have opportunities to research electives and to be more involved with that, and have support for that if you'd like as well.
I just noticed a comment about wondering about the longitudinal elements to patient care built into the program. So with respect to our program at McMaster, we have 2 segments where we would do 4 months. It can be 4 months, 1 year, and 2 and 2 the following year, which would be core family medicine rotations. When you're off service, we do have a half day each week or a full day every 2 weeks, depending on what is most convenient for our learners to be back in the office. So that's a great opportunity for our learners to actually be able to have continuity patients and be able to call back those patients that they were seeing the week prior. Right, so we'll switch gears over to Dr. Waters. I will hand her the baton to continue on with the presentations.
Sue and Liz, your presentation was so compelling. We've more than doubled the number of participants who are involved with us now since the 2 of you started. So thank you for that. Just going to switch over to share my screen here. Did that work for the screen share?
Yeah, we can see it.
That's great. Somehow I've ended up with a nice big picture of you, Christine, on my screen. Just going to try to minimize that so I can see my slides without signing out of the call here. When I first chose to come to Hamilton about 30 years ago now, I couldn't have imagined that time and time again I would continue to choose Hamilton as the best place to study medicine, to train to become a family physician, to launch my career and raise my family. And I'm really looking forward over the next several minutes to sharing with all of you some of my insights as to why Hamilton is a standout option for your family medicine residency training. My name's Heather Waters. I'm the site director here in Hamilton, and I'm joined today by Dr. Nicole Buchanan, who's one of our chief residents and who will be helping to lead the question and answer after I have a chance to share a few slides and a bit of information with you. In highlighting Hamilton's site, I'd like to focus on three different aspects: our people, our site resources, and then the city of Hamilton itself. Starting with the people of Hamilton site, one of the things that stands out to me most is the creativity and innovation, along with the enthusiastic and down-to-earth nature of the staff and faculty that we work with in our teaching units and at the central department every day. As a resident in Hamilton site, you become a part of robust interprofessional healthcare teams. So in terms of the provision of patient care as well as your own learning, you have the opportunity to train not only with other family physicians, but with a variety of different healthcare professionals who bring different expertise to the holistic care we provide to our patients. Although you are a diverse group of individuals considering family medicine and McMaster University for your training, with the breadth of clinical and scholarly interests of our faculty in Hamilton site, I have no doubt that you'll have numerous opportunities for mentorship related to your own special interests within family medicine. Hamilton has a vibrant resident community, and as our program's largest and original teaching site, we have a well-established history of excellence in medical education and medical scholarship. We look forward to welcoming 31 Canadian medical graduates and 8 international medical graduates into our incoming cohort in Hamilton for the upcoming academic year. Our residents enjoy getting together in groups large and small. Although it's been virtually over the past year, we're well underway with our vaccination campaign. Residents are right alongside faculty and staff, and we do look forward in the coming year to be able to gather in person once again. Let's shift over to talk a little bit about some of our unique resources in Hamilton site. The picture I'm sharing with you now is the David Braley Health Sciences Center, located right in downtown Hamilton across from City Hall, a new, bright, spacious, state-of-the-art building. This houses not only the administrative and research offices, as well as the education offices for our Department of Family Medicine, but for residents who match to our site, it becomes your academic hub where you get to spend time weekly, once we can be in person again, for your tutorials in inquiry and mental health behavioral sciences. Once a resident is matched to our Hamilton site, we have an internal process whereby we determine your family medicine home base and your longitudinal continuity preceptor in family medicine. We have 3 different teaching units, and the first teaching unit I'll highlight is located actually within this building, the David Braley Health Science Center, and it's called McMaster Family Practice. McMaster Family Practice is part of the McMaster Family Health Team and specializes in care of under-resourced and inner-city populations. It's our largest teaching unit, an academic family health team partnered with Stonechurch Family Health Center, our second largest teaching unit, located up in the suburbs of the Hamilton Mountain, as we like to call it. Stonechurch Family Health Center is where I practice, along with our program director, Dr. Sarah Kinsey. Another beautiful building and a bustling hub for resident care, offering broad-based general family medicine practice. Both MFP and Stonechurch have a team-based approach to resident supervision, although all residents have a primary preceptor, and they do offer in-clinic horizontal elective learning opportunities as well as in-house teaching sessions, again, once we're able to mix it up and be in person. Now, some of you might be a little more interested in a smaller, more typical community-based setting, in which case our community-based residency teaching unit, also known as CBRT, might be appealing to you. This was the unit that I trained in when I was a resident at McMaster University. Our CBRT is comprised of a number of solo or small group family practices, all located within either walking distance or a 25-minute drive of the David Braley Health Sciences Academic Hub. We have a few unique clinical rotation opportunities in Hamilton to let you know about. One is the Maternity Center of Hamilton, specializing in prenatal and hospital newborn care, especially for patients who, again, are from under-resourced populations. This is a family medicine-led rotation. A few other interesting rotations in Hamilton are the core pediatric emergency medicine rotation in first year and numerous elective opportunities in addiction medicine, mental health, care of the homeless, immigrant and refugee health, just to name a few. Of course, being matched to Hamilton, you have close proximity to McMaster University with its beautiful green spaces and amenities, but also an opportunity to get really involved with undergraduate medical teaching, both clinical and non-clinical. And our residents are all given opportunities to get involved with teaching of various sorts over the course of their program. Of course, McMaster Hamilton site is home to many other medical specialties as well, so there's a great opportunity to liaise with residents and faculty from other postgraduate programs. Lastly, I just want to highlight Hamilton, the city itself. Sometimes known as a big city with a small town feel, there is honestly something here for all of you, no matter how you like to spend your time outside of medicine. Boy, back in the days when we could gather in large crowds, maybe someday again, folks, you might have heard of our famous Super Crawl, an outdoor celebration of music and the arts that happens in September each year. Hamilton is very well known for its arts and music scene, and right next door to the academic hub downtown is the Art Gallery of Hamilton. Nice spot to take a break on your lunch hour. We're also known in Hamilton for our foodie culture, a ton of great restaurants and patios to check out if you're here, and right now we're keeping them going with curbside delivery and takeout. I think what's been keeping all of us sane throughout the pandemic is Hamilton's fabulous green spaces. We're sometimes called the city of waterfalls. There are over 100 of them here, not to mention the extensive systems of trails we have, not only just around the outskirts of the city, but all through the city. So whether you like biking, blading, hiking, running, sightseeing. There is a trail with a waterfall at the end to keep you busy every weekend. If you're into sports, either watching or participating, lots of opportunities here to get involved and to cheer. And if you're trying to think about spots to live in Hamilton area, we've got a lot of really family-friendly, walkable communities if you're relocating family here, or maybe like many of the residents at Hamilton site, you might prefer to live centrally within walking base of your academic hub and equidistant to all of our different hospitals through which you'll rotate for your rotation. I know you've got a lot of decisions to make in terms of the best spot for you to learn and head towards independence for launching your career into family medicine. Could Hamilton be your site? As those in the know like to say, future residents, it's hammer time. And I am going to try to stop sharing here. And Nicole and I would be happy to host any of your questions.
Heather, there's a question here. Could you give some more details on what was meant by horizontal rotation?
Yes, I would be happy to. So not just for Hamilton site, but across all sites in our program, when you're on one of your family medicine rotation, a full-time family medicine rotation, you're given the opportunity to spend a half day a week in some type of clinical activity, either an area of interest or an area to address an identified knowledge or skill gap. So our residents in general really highly value the opportunity they have to explore clinical learning opportunities for the half day a week while doing a family medicine rotation. And we call that our horizontal half day elective. I guess the other horizontal half day I should probably highlight is the longitudinal half day that residents would have back in their home-based family medicine practice with their primary preceptors. So when you're not in a full-time family medicine rotation and you're doing another rotation, we do want you to maintain continuity with your home-based unit patients and your primary preceptor who's your academic coach. And so throughout your other rotations, you do have the opportunity to you're expected to come back and remain connected to your core program, family medicine, in that way. I see another.
Okay, the next question is, how common is it for Hamilton residents to get their preferred choice of unit, MSP, Stonechurch, or CBRT?
That's a great question, and I would say that it probably varies a little bit year to year, depending on the number of residents requesting different places. What we do through our internal match process is we ask residents to tell us a fair bit about themselves and their interests. And we also ask residents to rank in order of preference the sites to which they would match. McMaster Family Practice and Stonechurch Family Health Center are each considered independently as a site, and then each individual community-based practice is ranked differently. So I would say that our successful match rates are very high. CBRT, the community-based program being the smallest, is usually the most competitive to get into, with 6 to 8 residents being placed in CBRT each year, just depending on our preceptor pool there. Usually residents who want to get into one of the academic teaching units, there's a lot more capacity there, so there usually isn't an issue that way at all.
So maybe sticking with discussion around the units, there is one other question. Could you speak more about CBRT versus the team-based approach to preceptorship? How is that decided for each resident?
Nicole, I've been talking a lot, so I should give you an opportunity to answer that if you'd like to.
Sure. Yeah, I can speak more to the team-based, I suppose. So I'm located at McMaster Family Practice, which is in that big academic building that Dr. Waters showed. And I really like the team-based approach that we use there. So basically, I have a primary preceptor who I get to know quite well. When I learn the sort of practice management parts of family medicine, I'm working on his practice specifically. But for many days of the week, I'll spend time supervising with other physicians in the office. And I think that gives advantage both in terms of getting to know different doctors with different interests and skills and experiences, and also just kind of seeing different approaches to things. So I think for me, it's been a good balance of continuity with one person, but having some breadth with a variety of preceptors. Versus from what I understand in CBRT, it's typically more of a paired one-on-one, though sometimes I think people are working with other physicians in the practice, so maybe you can speak to that better.
Yeah, thanks, Nicole. Maybe just to piggyback onto what you've expressed so well is that in CBRT, there are some practices that would have two different primary preceptors within a given teaching unit. So you might be one of a couple residents there, sometimes even three with one or two preceptors in some of our community practices, and other of the community preceptors would have the one primary preceptor and one resident. So there is a little bit of variety there. And I just want to assure people in terms of the internal match, they're handmade matches done between myself and our 3-unit education coordinators based on the information you provide us in the internal match. So it's not a machine-generated process. It always spend a fair bit of time trying to make matches that we think are going to be really successful for folks. I think I just saw a question flash up in front of me about experience with IMGs in Hamilton site. So we do take IMG residents into our Hamilton site every year. So we certainly have the longest history in terms of training IMGs, and we have consistently welcomed the most IMG learners into our site each year. And there are also obviously a lot of IMG learners across other postgraduate programs as well. So beyond family medicine, there's a fairly good IMG cohort here. So some of the IMGs that come to us are Canadians who studied abroad, and some are actually folks immigrating from other countries. So it really is a diverse and heterogeneous group, and we're always quite excited to welcome them into our family. And, once accepted into our program, our residents are our residents. We realize everyone comes with a different background and skill set, and, we meet you where you're at and go from there. Okay, and we're out of time, so we're going to pass it over now to Dr. Carl Stobbe and our Niagara group.
Thanks very much, Heather, and welcome. So my name's Dr. Carl Stobbe. I'm a family doctor in Niagara, and together with me is Lauren Wilson, one of our residents, and I think I've almost got this. That should come up shortly. There. You can see that on your screen now. Heather, is that right? Is that working?
Yeah, that's
okay.
Great.
Beautiful. Okay, so welcome to Niagara. Nobody calls it the land of waterfalls and rainbows except me every year at CARM, so you can take that with a bit of a grain of salt. I'm going to talk to you about what's different in Niagara. I think what you'll find on the CARM's website, the McMaster information, and the McMaster Family Medicine website, you'll learn a lot of the details about the individual programs. I think what I'm going to try to do is just hit the high points of what might be different or special about each site, and that's really our intent tonight. So what I'm going to talk about is 3 features as well. One is integration, and I will also talk to you about the clinical environment and the academic environment. And through some pictures, you'll see about the environment as well. So integration is one of the things that is a sort of a differentiating feature in Niagara. So your first year is almost entirely integrated. So you will spend 3 months doing family medicine and pediatrics. So you'll spend some time in hospital-based pediatrics, some time in office-based pediatrics, and some time in family medicine. And then you'll have another 3 months of family medicine, similarly split with emergency medicine, with your time split between the two. It's not like you're doing more work. It's just that you're doing both at different times. And then you have a 4-month block, a 4-block section of family medicine with obstetrics and gynecology. The only part of it that is not integrated in year one is time on the internal medicine teaching unit, and it is a type of CTU. There is call. It typically lasts until about 11 o'clock or midnight. You are in the hospital. Most of the time, you're the most senior learner on the team, so you're supervising often clinical clerks with faculty very close at hand. So that's the first year. I'm happy to talk about afterwards if people have questions about modifications for COVID, but this is how things are under the normal state of affairs. So why would we do that? So part of this is that you spend basically the majority of the year always in family medicine, at least a couple of days a week, sometimes 3. So as you're in your first year, you sort of form that identity of a family doctor. And the idea is you go into your hospital rotations learning from the hospital-based docs what family doctors need to know. And then you can take that back into your family practice, talk to your preceptor. This is how they did it in hospital. How do we do this in the community? So it allows you to kind of apply the learning to practice almost immediately. You've got a lot of continuity of care. So patients that you pick up at the beginning of your first year, you will stick with all the way through the year. You can do that in any spot in Niagara for a half a day a week, in any place at McMaster for a half a day a week. In Niagara, it's usually 2 or 3 days a week. And then, of course, there's a continuity of preceptor. You will be paired with a preceptor. Occasionally, there will be others in the practice that may work with you from time to time. But it's basically a one-on-one teaching relationship, and so you get to know that person pretty well over the course of a year, basically in that practice 2 or 3 days a week. The top 5 beaches in Niagara is not part of this. It's the background. So the clinical environment, basically, we have also a brand new regional hospital. There's four different hospitals plus 2 small, tiny, used to be hospitals that still offer some learning opportunities. And typically what happens is, again, it's a small site. It's very focused on learning. So you're required, there's no requirement for residents to carry out the work. So this is almost entirely focused on your learning. So you're usually the senior resident on most specialty rotations. We are starting to get more specialty residents, so internal medicine, pediatrics, and that sort of thing. You may not be the only resident, and so that comes with usually mainly pros rather than cons. So they won't put 2 residents that are both R1s from the same specialty on the same rotation. If there's a specialty resident, it'll be a senior. So you get some help with supervision, advice about teaching, and that sort of thing. And the ratio between preceptors and learners are quite small. This is the map of Niagara. You can see Hamilton off to the left here. These 3 sites are part of the rural stream, but we also have some regular stream residents placed there. So Niagara has essentially 10 residents altogether, 7 CMGs, 1 IMG that comprise sort of the, so to speak, urban sort of set. And then we have 2 rural stream residents, and they're actually full rural stream residents. They're in practices in this area here. But they do all the sort of specialty work, social things, and academic sessions together with the rest of our residents. So it's often hard to tell them apart, but the curriculum is slightly different there. it's my firm belief that, sometimes people end up matched to an urban site and they really want rural training. And so we have, I try to make sure that each year we have at least one offering that's rural in even the urban stream. So we have Port Colborne and Beamsville as two sites, and they alternate in their availability. The academic environment, so we have a small campus, undergraduate medical campus in Niagara. And the academic site for the residency is co-located with that campus. As at all sites right now, we're doing this all virtually, but when we can get together, it's a custom-built building for McMaster and or facility for McMaster, and it serves our needs extremely well, offers some interaction with students, and there are some very interesting teaching opportunities. I would say many or most of our residents at least participate in clinical skills teaching, where you have a small group of students and you teach them interviewing and physical exam skills, and you're trained in how to do that. But there are many other sort of teaching opportunities besides that, including being a tutorial leader and that sort of thing. Again, because it's a small site, and I think you're getting the sense that McMaster really engages with their residents, and it's a very sort of resident-centric program. And in Niagara, one of the ways that we support your journey towards leadership is to offer lots of opportunities. So we do have a couple of chief residents, but there's a number of other opportunities to lead your cohort, and it ends up that somebody could lead we could have a leader among all the residents, just depending on how engaged and interested you are. It's not required, but it's available. And I think that COVID has sort of changed everything around for a temporary period of time, but with a small site, 10 residents per year, there was always a lot of interaction between first and second year residents, family medicine residents, and visiting specialty residents within the hospital. And residents and medical students, lots of opportunities for both social as well as academic teaching and learning. So that's basically what I've got. I think that I'm very happy to talk about sort of things that changed with COVID or anything else that people have questions about at this point.
There's a question about, is the rural stream open to IMGs? So the rural stream is actually a completely separate application process. They're Grimsby, so that would actually be a question for the rural stream itself. They're just kind of, because they're close to Niagara, from an academic standpoint, they are lumped in with us, but from an admission standpoint, they do their own admission.
Yeah, so I can jump in and answer that. So there is not IMG positions connected to our rural sites. So we have 6 rural sites, and there is not, we have positions open for IMGs at 5 of our urban sites. So Hamilton, Halton, Niagara, Kitchener-Waterloo, and Brampton.
And for IMGs interested in a small site, as you heard tonight through the presentations from our 3 sites, there are smaller community, more community-based sites available in some of the small towns around our urban centers, like Georgetown with Halton, like Carlisle with Hamilton, like the Grimsby-Beamsville area, Carl, with Niagara. So as an IMG, there are opportunities for that smaller community-based, less resourced option, even though there isn't an IMG spot within the rural stream itself.
And perhaps I should just also chime in and remind everyone that McMaster Family Medicine Residency Program does have a 2-block rural rotation for all residents in their second year. So there are the opportunities to get a truly more rural experience if that is something you're after as a Canadian medical graduate or as an IMG.
Even thinking about some of our other sites that aren't showcased here tonight, but help me too if I'm missing anything, Sue and Carl, but I'm thinking about our Brantford and Kitchener-Waterloo sites, and I know that they have some smaller community-based practices affiliated with them as well. I'm not
like
sure
Progress and Alora.
Yeah. Oh, Carl, you're on mute.
Okay. I can't speak for other sites, but I think that pretty much all the sites do a very, very selective hand match of residents with preceptors that meet their interests or locations that they'd prefer to be in and that sort of thing. So you'll get a fairly detailed request to identify what you're interested in and what your priorities are. So if you can't get everything you want, what's the most important thing to you? And then we all try to meet that as best we possibly can. On the small sites, as Sue and I mentioned, we've got like 8 or 10 residents a year, so it's not a big task. But even at the Hamilton site, Heather, I can't imagine the task that must be, but it's amazing that you're able to carry that out.
Carl, there is a question here around opportunities for learning and procedural skills and simulation, if you could speak to that at the Niagara site.
Yeah, Niagara site, there is, it depends really on which procedures you're interested in. So we have actually, we have a post-grad general surgery residency program in Niagara, a McMaster site. The surgeons have been teaching for years, and you can basically do an elective in surgery, and they will have you open and close abdomens pretty much from the beginning. You get a lot of hands on there. You'll be first assist. So if you want that kind of procedure, but we have a number of docs that actually do a lot of procedures in their practice. Most of our family doctors do a lot of procedures in their practice anyway. There's a few that do more, and then we have we developed an elective in musculoskeletal medicine, for example. So if you wanted to learn joint injections, we have that option. So it really just depends on what procedure you're looking for. I don't think any resident has escaped Niagara deficient in procedural skills unless they didn't tell me that they were interested. And I'm pretty sure that we all have our own way of helping residents achieve what they want. But yeah, there are lots of opportunities. And of course, if you're really interested at the beginning in having a very procedural practice, I would match you with one of our smaller locations because that's typically where those practices are more procedure rich. I'm not seeing the same questions as everybody else, so I'm glad you're reading them to me.
Carl, I was feeling the same, and some of them are just going to Christine as the host. So yeah, we're all in the same boat. I think Christine can see all of them, and some of us are just seeing a selection.
I do see them all. I don't see anything new coming in. There was a question for Gordon. I think you answered that in the chat, but about why you chose Niagara. Maybe you can speak to that and maybe highlight what you enjoyed about being at the site.
Yeah, absolutely. So the first thing, which I think many of the sites have already alluded to, is that we're not a service-heavy site. So when we're in the hospital, the preceptors are very aware that we're there for a learning perspective. So they're all very open to teaching you on all of your off-service rotations with the direction of, we expect you to know this as a family physician referring to us or incorporating this into your care. So I find that very helpful because they do try and take a family medicine approach to it rather than like an obstetrician solely from a high-risk pregnancy standpoint or a direct internal medicine standpoint, even if you are going to do hospitalist. So I find that very helpful. The other part that I think is very beneficial and I really enjoyed during my first year as a resident was the integrated component. I think it was great because it allowed me to actually get very comfortable in my clinic for extended periods of time because I was there so often. And also it gave a very good professional relationship with my preceptor to the point where in second year I was very comfortable talking to him about career goals. If which locums would be appropriate or what he thought about stuff. So I think that the relationship that you have is and I'm sure it's the same at all the other sites too, but I just know that the relationship was definitely, the foundation was built during that integrated time. And yeah, those are kind of the two big reasons why I think that the Niagara site's great.
So thanks for putting those questions up, Christine. So I see one about during the integrated rotations, are you doing the call of the off-service rotation? And the answer is yes. We actually struggle to fulfill the requirements for a family medicine based on call experience in Niagara. We're working hard to rectify that, but currently, unless you have a certain one preceptor who does a lot of OB, there's no on-call for family medicine. And like I said, we're working on that, but currently all the call would be on the off-service rotations. And research opportunities during the family medicine residency. I think it was mentioned that the IQ curriculum provides some research-like sort of quality improvement training. If you really want to do research, I think the opportunities vary a little bit between site. I know there's lots going on in Hamilton, and I think that the other very likely sort of higher kind of level of research opportunities might be the two sites that have campuses. So Waterloo and Niagara. Now, Sue, there might be more going on there, and I defer to you, but I know that we've got certainly more than a normal community site, but not as much as Hamilton in terms of research opportunities and support.
Certainly for us, it's been on a smaller scale, and a lot of times we do go to Hamilton just because the proximity is so easy for us. So we do often end up going through the central site.
Our program for residents at any site does have a resident research lead and a research stream, and it's an aspect of our program we've been continuing to develop and explore in terms of opportunities. I mean, the bottom line is a 2-year residency is very demanding, and the focus is on your clinical learning because you need to be able to hit the ground running, well prepared to do family medicine practice. So all residents do the mandatory quality improvement exercise, and it's a smaller number of residents with more academic scholarship and research interests who would expand that project and do further research beyond. But we do have leads and supports and a very active and robust research department at McMaster, so we can connect to those people who really want to dig into that a little bit more.
And I see another question here. Do residents receive training on how to respond during on-call shifts, sort of a nightmares workshop? Interesting. Lauren, you might want to comment on that. My perception is that without being rude or anything, like in Niagara, I just don't think that's needed. Now, it may be that it is, and we need to create that, but I just think that there's a lot of support. Lauren, what do you think?
So I think so first and foremost, there is a ton of support. So you are never left to your own devices when you're on call. I think what the question may have been getting at was that sometimes at a tertiary center, they have nightmares on call modules because you're the one holding the pager, let's say on internal medicine. And you only hold, quote, the pager, which in Niagara on all the hospitals is your cell phone, on your own patients. So you're not going to get called about a patient that you don't follow, and you're not going to get called in the middle of the night when you're not on call. And on the times when you're only on call until 11, because unless it's a weekend on internal medicine, you don't do overnight call, then you don't get called about something that's not your patient. You only get called about yours. So it's not so much of you're not going to run into as many nightmares as you will, because you're the one who knows everything that's going on, rather than flying in and getting told that a patient that you know absolutely nothing about is currently having a heart attack. The same thing kind of goes with the obstetrics rotation, in that the majority of the staff are fairly hands-on. And so for deliveries, you'd be first call, again, from on your cell phone, not a pager. But someone is always kind of in the background walking you through everything and keeping you either on a long leash if that's something that is more applicable for you, or on a shorter leash if you're a beginning Block 1 R1. But the support's always there, and I don't think for what Niagara does, because we don't do sort of that pager system, a night nurse module wouldn't be beneficial.
I would certainly echo that, what Lauren is saying from the Halton side as well. We do tend to have that very close relationship, so it's unlikely you would run into a situation where you're feeling very panicked and very unsupported. During our Block 7 rotation, which is your family medicine block back along with your academic, we do have a very popular request that comes up every year from the residents. One of our hospitalists does a session on on-call emergencies, and it's one that's well loved by all of our residents. We also do have a new SIM lead for our location. Unfortunately, this time around, given COVID, it was done electronically, but we do have a very robust system at Joseph Brand with respect to SIM, particularly in the emergency department and the pediatric department too.
Folks, I don't know where an hour goes. I can't believe we are past time already. I would love to be able to keep talking. I'm sure there are more questions, but out of respect for the panel, out of respect for all of you who have taken an hour out of your evening to get to know us a little bit and find out about 3 of our McMaster sites, we do thank you so much for joining us, and we thank you for your questions. I specifically want to thank Lauren and Liz and Nicole, our residents, for giving up your very precious time out of hours tonight to join us and help respond to questions and represent your sites. At McMaster, we really prioritize resident involvement in all aspects of the work we do clinically and educationally, and our residents are valued members of our team. So with that, we'll close off tonight. Best wishes to all of you with CARMS, and please join us for some of our exhibit halls and resident-led sessions and town halls to hear about other sites. There's lots more to know about MAC that we haven't covered yet. Take care, everyone. Have a good one.